Hi, Dr. Dave Webster, and this is part of my ongoing video blog series on the travesty of patient access to PET-CT in the Ontario Liberals' so-called evidence-based and patients-first healthcare system. We've been looking at the Ombudsman's role as what you might imagine and what they would like you to believe are watchdog or safeguard roles to protect citizens from potential abuses by politicians. And in particular, we're looking at whether or not they are protecting the interests of some of our sickest and most distressed patients, and that is our cancer patients. Ultimately, we've been asking whether, as they say, they're watchdogs, or are they really acting as lapdogs? So this is a particularly important one because now it turns out we do have a patient ombudsman, and it's Miss Christine Elliott. And you can decide for yourself, but my experience is that Miss Elliott will take the efforts of the Ombudsman's office to help the agenda directed our patients to an entirely new level. And why would this be? Well, that's because she is the patient ombudsman. The previous ombudsman I've dealt with in those 3 videos, they were dealing with the technical aspects of how these policies were, the processes by which the policies were put in place, in spite of the fact they'll tell us that, you know, we were really, as experts, we thought they were dealing with the policies rather than the process. Of course, in other words, they just dismissed every concern that we raised. So this is going to be part 1 of that video, and why we need to be very, very concerned about what Miss Elliott is actually capable of is because with the recent changes in Mr. Patrick Brown stepping down as the head of the PC party, she's announced her bid for the PC party. And she currently has the most support of any PC candidate. Now, I must be very clear, I am not in favor of any of the candidates because, as you might have guessed, and I will make clear in subsequent videos, every party in this province is and has been aware of the issues around PET. So the only way we're actually going to get any change is if we force this to be an election issue and confront all of them. But after you watch this video blog, you can decide whether we should be trying to support Ms. Elliott's bid for the leadership, or whether we should be doing everything we possibly can to ensure that she is not, yet again, a politician who could become involved in going after cancer patients, and in particular showing such contempt for them. A little bit of background: University of Western Ontario law degree, and then, as you can see, she spent many years from really 2006 to 2015 acting as an MPP for Whitby Ajax or Whitby Oshawa, and she a couple of times tried unsuccessfully for the leadership bids for the PC party, and then she became the deputy leader of the PCs from 2009 to 2015. But what happened was, in July of 2016, she was appointed by the Liberal government to be the first patient ombudsman. Now, the only reason I even bothered to waste my time with Ms. Elliott was because, I thought, well, she's a conservative, they're Liberals, it's possible maybe she might actually consider taking a separate approach, and particularly in light of the fact with an election coming in the future and the Conservatives might have been in power, there was some vague, distant hope that she might take a different approach. Now, the key points that I made to Ms. Elliott in overall the situation was that we as her physicians were forced to practice Cancer Care Ontario's compulsory standards of care, which ultimately, as you will see, will lead to Carol undergoing a terribly mutilating, contraindicated therapy appropriately called radical radiation therapy to her pelvis. Now, the point is, if Carol had had what was already in a long-standing standard of imaging management for the staging cervical cancer, this never would have taken place. And finally was that patients in Ontario are fully entitled to have all their questions answered about any test procedures and so on. That's just simply part of what we expect as a patient. And but what the difference I made in this case was I said, listen, who better to answer these questions, since I don't agree with the approach you're taking, but who better to answer the questions and the people who would actually make the decisions as to whether or not Carol would get access to the PET-CT or not. But as you will see, they absolutely refused to acknowledge her questions or obviously not respond to them. So if you've not seen my videos on what I've labeled as the assault on Carol, I'd ask that you please consider going back to my website or my YouTube channel. There's the title, Dr. Dave Webster, McMaster, and I've got a number of videos out. One was an introductory video, and then there's 2 longer versions that give more detail. And then actually, if you just go to the CCO mandated assault on Carol's short version, that will contain all the critical elements. And when you're on that, please consider liking and subscribing to that video channel. We need to get this information out, as I hope you will realize or agree with me. We need to get this out as widely as possible to make sure that all political parties are going to be forced to finally deal with this issue after all these years. But I want you to keep in mind as you watch these particular 2 videos is that it was my advocacy for Carol to try and prevent what happened to her from happening, that led directly to the threats against my medical ability to practice by Cancer Care Ontario and the College of Physicians of Surgeons of Ontario, who I have to get my license from. So the critical issues in Carol's case was that she's a nurse. She just retires and unfortunately is diagnosed with cervical cancer. And now, because of Cancer Care Ontario forced standards, she's only allowed to have investigations in ultrasound, CTs, MRs, and those sorts of things. By early December, they decide that in consultation with the quotes evidence-based medicine surgeon guru from McMaster University, remember McMaster Evidence-based School of Medicine is the one that's totally behind blocking PET, that actually if she undergoes this radical radiation therapy to her pelvis followed by extensive surgery to remove the pelvic organs involved, that there's a good chance of a possible cure. So she consents to this. Now, what did the CTs and MRs show that we had to do? Well, the only thing they showed was that the primary cancer site they identified in the cancer, but there was a little finding on the left side in her pelvis. A lymph node is where cancer often spreads to, and it by CT and MR criteria maybe was a little big. The radiologist, as typical, since the technology is incapable of determining whether it's because cancer or not, just waffle on it and so on. It's not a definitive finding. So at that point, I'm asked by Carol's oncologist to become an imaging consultant and what would be the imaging management. And of course, the world literature for quite some time had made it clear that she should have a PET CT to properly stage her and decide on treatment options. Now, because this test is not routinely covered under this indication by OHIP, you can then apply to something called PET Access, which will consider granting a one-off for a PET CT. So the application process starts in December, and it's a prolonged process. Part of that may have been just that it's Christmas, but nevertheless, what the bottom line is, she is not allowed a PET CT before her therapy. She will be allowed one after the therapy is complete. So she gets this PET CT after the therapy in the end of February. Now, it is at this point that the senior executives from Cancer Care Ontario then call the senior administration at the hospital Carol's at, and basically the administration at the hospital is told to shut me down or else, and that is when my privileges first started being threatened. If I was to continue to speak to patients or physicians about PET or even use case examples without any identifiers, I would lose my right to work at that hospital. So then in April 2017, I have my meeting with Ms. Elliott, which was interesting because you normally don't meet with the Ombudsman, so I thought that was a good sign. And so I speak to her extensively about the issues, so she really now has a clear understanding, as much as I possibly can, to a person who's not a physician, of how PET works, and in particular the urgency of Carol's case. So this is Carol's PET CT, which occurred after the therapy. So you can see this is the primary cancer here, but this was the area on the CT and MR where they weren't quite sure. Well, it's very clear that this is evidence of cancer there, so we found that, of course. The next finding was, what is this in this side of the pelvis? Well, this actually is an entirely normal-sized lymph node by CT and MR criteria, but it clearly has evidence of cancer as well. Then there's another little series of findings up here, and this demonstrates that there's now lymph node metastasis, again in normal size lymph nodes by CT and MR, but it's now out of the pelvis. There's another finding which raises the possibility here that she might have metastasis to the right adrenal gland, and then finally, there's a little finding you vaguely see up here, but when you look at it, we can now see that she's actually already got spread to her lungs. So the PET CT shows that from day one, she actually had untreatable terminal terminal stage 4 cervical cancer. It was bad news, but it was the correct news. But because she wasn't allowed to get the correct staging of her disease, she will now undergo the radical radiation therapy, and this was absolutely contraindicated. It never should have taken place. And quite clearly, I would argue that this was an assault on Carol. And I actually did consider seeing if we could get, provincial police or somebody to consider laying charges. I mean, you may remember that when Dr. Hicks from Australia, who wrote on what happened in Ontario, he did eventually go through a process that led to criminal charges against the Australian government, bureaucrats and experts. So this, what it did correctly. So what were the implications for Carol? And as you will see, and especially if you've seen those previous videos, Carol will now suffer for the rest of what will be a short life from the expected side effects of the radical radiation therapy. I mean, she's a nurse. She knew what she was going into, but she was told there was a chance of cure, and therefore she was willing to have and put up with those side effects and risks, right? But now she goes not only from being told that, no, you're going to die because we misstaged you, misdiagnosed you, and so on, but she's now going to have to live with these complications. And what were those complications? I mean, this is normal bowel here, not Carol's, of course, but this is the kind of radiation damage that does occur to bowel, and you can imagine the symptoms from that. Similarly, the bladder will be included in these therapy fields, and this is the normal bladder, and this is the kind of hemorrhagic and radiation change to a bladder. So then, further on, within approximately 3 months of that PET-CT, she's admitted to hospital with terrible, uncontrollable pain, and that's why she has to be admitted. She's got swelling of her lower extremities, and this is the kind of lymphedema she would have because of now the blocked flow from her pelvis, in part because of that radiation therapy that never should have taken place. Now she becomes very depressed, and she essentially cuts herself off from her friends and support groups, and one can understand why. She's dealing with a lot of bad stuff here. So the point is Carol is never well enough to leave hospital, and eventually moves into a hospice. She never did get a chance. I remember seeing her in sort of late or early October when she was really hoping to get home and spend some time with her family, but unfortunately Carol dies in October of 2017. However, even though I met with Ms. Elliott in April and emphasized the urgency of deciding on this matter, Ms. Elliott still has not made any comments or rulings on Carol's case. So in part 2 video, what I'm going to look at is now in detail my interactions with Ms. Elliott and her ruling on what happened to Carol. So thanks, and let's do what we can to make sure that Carol's death was not in vain. That's what her hope was that because of her suffering, others may not have to. It won't be happening because Ms. Elliott, I can assure you, it'll only happen if we are prepared to do something about it. Thanks.